Hey guys, I'm Dr. Ashley Ray and I'm a breast surgeon at UCBC. I wanted to talk to you a little bit about breast cancer prevention as February is Cancer Prevention Month. So in America, 250,000 women are diagnosed with breast cancer annually. It's the most common type of cancer we see in the United States. And that statistic calculates to 1 in 8 women. So we all know somebody in our family or our friend group that's going to be affected by this illness. It's also the second leading cause of death in women, second only to heart disease, with over 40,000 women succumbing to this illness annually, which are pretty staggering statistics. But the good thing about breast cancer is, since we have started utilizing mammography in the past 30 to 40 years, we've seen tremendous decreases in breast cancer fatality. Breast cancer mortality rates have dropped by 30% since mammography has come into fruition. And the reason for that is mammograms help us to detect things so much earlier. As a matter of fact, women who are diagnosed in early stages of breast cancer, so stage 0 to 1, which is typically what we see when we have our annual mammograms, have greater than a 95% survival rate at 5 years, meaning that from a statistical standpoint, we're not going to die from breast cancer. There's lots of things that can increase that 1 in 8 risk. So family history, genetics, for example, breast density, lifestyle changes, which are things that we can easily modify. So having a healthy diet, for example, maintaining a healthy body weight, not overindulging in alcohol, not smoking. Those are all things that we can actually modify from a risk reductive standpoint. Also, doing 150 minutes of aerobic exercise a week, or 2 weight or resistance training sessions a week can also decrease our risks of breast cancer tremendously. And what else can we do? Starting at age 40, we want to make sure that we start having annual mammography for those of us that are an average risk of breast cancer, so us that would be in that 1 in 8 category. If we have a family history that puts us at a higher risk of breast cancer, we can start screening earlier. And also, if you have a higher than 20% lifetime risk of breast cancer, you can start by alternating mammogram and MRI going forward. So breast cancer is really prevalent, but it's highly curable, and that's the thing that we need to keep up with in the back of our mind during this Cancer Prevention Month. Modify your lifestyle choices, but let's do our part to stay on top of our mammograms and catch things early if we do get diagnosed.